Jennifer, I want to go back to April 26th. April 26th, the EU was really looking at letting American tourists into Europe. There was a better tone. Hospitalizations now, led by the unvaccinated, have returned to where they were April 26th, and it is not a good trend. What is the character of those hospitalizations?
Yeah, it is not a good trend. I mean, it is a different patient population than had been hospitalized earlier in the pandemic. In particular, we have fortunately seen good vaccine uptake against the populations that are most likely to become severely ill, the older adults. And so now the people who are being hospitalized are younger. Although age is the single biggest risk factor, it's not the only risk factor. And so certainly people with underlying health conditions, and it's a list, it's a lot of people that fit in that category, but also even potentially people who have no underlying health conditions are unfortunately now being hospitalized. And it's so tragic because vaccines can prevent that from happening.
Jennifer, we used to talk about trying to achieve a 70% vaccination rate in this country. Can you compare and contrast the reproduction rate of this variant, the dominant variant right now, the Delta variant, compared to what we first experienced 18 months ago, and what that means for those kind of goals, whether 70% now needs to be 75, 80, etc.?
Yeah, I mean, it does likely need to be higher. The Delta variant is spreading much more quickly, and it's potentially spreading a bit earlier in people's illness, possibly when they're not even feeling much. So that complicates things. So the fact that if you're sick and you're out and about, you can infect more people than you would have with earlier forms of the virus just makes it harder for public health officials, to outrun it, to use other measures to try to control it. And that's why it's really important that we don't have to do that we can prevent those infections from occurring in the first place. And that's what vaccines are great at doing. Not perfect, but great.
Masks. That's the conversation down in DC, Jennifer. You know it's back on the table. Politico this morning, return of the mask. The Washington Post going with White House officials debate masking push as COVID infections spike. If you've been vaccinated, Jennifer, what does a mask do for you? What does it do for others?
Sure. Well, listen, as I said before, the vaccines are pretty good at preventing you from getting infected. That said, we know that there are some people who are still going to get ill potentially, but it'll keep them out of the hospital. It'll be mild. It'll be the kind of illness that if that's all the virus could do, we would have never heard of this virus in the first place. So if you're somebody in that category where you don't want to get that illness, then wearing a mask, even though you're vaccinated, may be helpful. Your need to do that is greater when you're in a place where there's just a lot more illness around you, where people are more likely to be infected, where there's lower protection overall in the community because of low vaccination rates. That said, don't believe that the vaccines don't, give you some protection. I think there's been a rising narrative about that it's really disturbing to me.
Are schools one of those places where you need to be more careful? Jennifer, my home state of Virginia yesterday urging everyone in an elementary school, students, teachers alike, to mask up, given under 12 still aren't vaccinated. As we approach the school year, is it safe for students to be returning?
Sure. So first of all, we know that it is possible to return children to school safely, and it's really essential that we do so after this past year and a half of educational disruption. That itself carries harms. I've got 2 young kids who are too young to be vaccinated, so I'm very much in that boat. So we can do it safely. Now, it has been recommended that kids, particularly those who can't be vaccinated, wear masks. Truthfully, I think it's going to depend on what the level of infection in the community is. If you're in a community that has done its part, has vaccinated its adults, and there are very few cases, it seems hard to think that you need to wear masks in schools. That said, if you want to have zero risk tolerance and let's just get them back and make sure they're as safe as possible, then that's an important tool to use. I think in schools where the case numbers in the surrounding communities are raging, then masks are probably an important tool, because we do know that if there are cases among kids in schools, it follows what happens in the surrounding community. I do have to stress, though, that overall kids are at lower risk of serious illness from all forms of the virus, including the Delta variant. There's been some, I think, confusing conversation about that lately. And as a parent, I would want other parents to know that. So, we face those risks with what data we have right now.
Well, Jennifer, school is not back in session yet. It is still summer vacation, and it's the summer season in Europe, too. And yet anyone in Europe looking to take a vacation in the U.S. still can't do that. The Biden administration hasn't yet made a decision. If you were advising the president and the people around him as to whether or not that's safe, given the concerns of the Delta variant, what would you say?
Well, first of all, the Delta variant is already here and it's raging. So if we're not letting people in because we want to keep it out, then that ship has already sailed. I think there's probably political pressures to keep the border closed because people, and to prevent people from coming because it's probably just easier. But I'm not convinced that it's doing much for us epidemiologically.